spontaneous efforts are good, then we can select assist control or PSV, otherwise we can go to for SI only. PIP will keep minimum. PIP will keep minimum because there is no lung pathology. If you are giving more PIP, then hyperventilation will be there, CO2 washout will be there, and hypocarbia will be there. That will lead to the decreased cerebral perfusion. Okay, so we'll keep PIP minimum. PEEP also will keep minimum 4 to 6. PEEP will be minimum because there is no lung pathology, lungs are open, lungs are clear. Then rate also will keep minimum 20 to 30 rates because babies we are just supporting for hypoventilation. So rate will be minimum, PIP will be minimum, PEEP will be minimum. Okay, I time, E time will be like I time we can set for time baby 0.4. FiO2 will keep minimum to maintain saturation between